CAPGRAS syndrome is an psychiatric disorder. Look at this picture, shows that imposter, not real. Then MRI for diagnosis. Look at this. A detail going on. Introduction. CAPGRAS syndrome is a rare psychiatric disorder in which a person holds a delusional belief that someone close to them, such as spouse, family member, or friend, has been replaced by an identical looking imposter. It is classified as a type of delusional misidentification syndrome and is commonly seen in association with psychiatric illness like schizophrenia or neurological conditions such as dementia and brain injury. Definition: CAPGRAS syndrome is a psychiatric delusional disorder characterized by the false belief that familiar people, often loved ones, have been replaced by imposters who are physically identical but psychologically different. Etymology: the syndrome was first described in 1923 by French psychiatrist Joseph Capgras and his colleague Jean Rabel Lacroix. They named it I illusion des seises, illusion of doubles, later refers to as Capgras delusion. Epidemiology: rare condition, exact prevalence is unknown, more common in females than males, frequently associated with schizophrenia, especially paranoid type, dementia, example Alzheimer's disease, Leo's body dementia, and brain injuries. Reported prevalence in schizophrenia patients about 4 to 5 percentage, more common in middle age or old adults with neurodegenerative disorders. Types: CAPGRAS syndrome can be classified based on its underlying causes. 1. Psychiatric CAPGRAS syndrome associated with schizophrenia, bipolar disorder, or major depression with psychotic features. 2. Neurological CAPGRAS syndrome associated with dementia, traumatic brain injury, epilepsy, or stroke. 3. Acute transient CAPGRAS syndrome, temporary, often linked to substance use or medication effects. Causes: The exact cause is unknown but associated with 1. Schizophrenia, especially paranoid type; 2. Neurodegenerative diseases, Alzheimer's disease, Lewy body dementia, Parkinson's disease; 3. Brain injury or trauma, especially affecting the temporal lobe or right hemisphere; 4. Epilepsy, temporal lobe seizures; 5. Substance abuse, drugs, alcohol; 6. Medication side effects, antipsychotics, dopaminergic drugs. Risk factors: 1. Family history of psychiatric disorders; 2. Female gender; 3. Advanced age; 4. History of brain injury; 5. Cognitive decline, dementia; 6. Coexisting mental illness. Complications: 1. Social isolation due to mistrust or loved ones; 2. Aggression or violence towards the supposed imposter; 3. Worsening psychiatric illness, schizophrenia, depression, etc. 4. Decline in quality of life and daily functioning. 5. Increased caregiver stress and burnout. Pathophysiology. Pathophysiology of CAPGRAS syndrome, step-by-step process. 1. Face recognition intact. Fusiform face area FFA identifies the person correctly. 2. Emotional response impaired. Connection to the amygdala lymphatic system is disrupted to no familiarity feeling. 3. Mismatch detected. Brain sees the face but does not feel it belonging to the loved one. 4. Aberrant salience. Dopamine dysregulation exaggerates the mismatch, making it seem very significant. 5. Defective belief evaluation. Prefrontal cortex insight regularity testing fails to correct the false idea. 6. Delusion formed. The brain resolves the conflict by concluding this looks like my spouse, but it is an imposter. In short, recognition right plus familiarity wrong plus impaired reality testing imposter delusion. Signs and symptoms. 1. Belief that close relatives friends have been replaced by imposter. 2. Suspicion or hostility towards the imposter. 3. Anxiety and fear. 4. Depression or withdrawal. 5. In some cases, misidentification extends to places, objects, or even pets. Diagnosis. Diagnosis is in clinical based on patient's history and Presentation tools may include 1. Psychiatric evaluation DSM-5 criteria for delusional disorder. 3. Neuroimaging CT MRI to identify brain lesions or atrophy. 4. EEG to rule out seizures disorders. 5. Cognitive tests example MMSE, MOCA for dementia. 6. Differential diagnosis schizophrenia, other delusional disorders, dementia, delirium. Nursing diagnosis 1. Disturbed thought process related to delusional misidentification. 2. Risk for violence towards self or others. 3. Impaired social interaction related to mistrust or loved ones. 4. Anxiety related to fear of imposters. 5. Caregiver role strain. Medical management 1. Antipsychotics example risperidone, olanzapine, quetiapine. 2. Antidepressants SSRIs, SNRIs if depression is present. 3. Mood stabilizers lithium, valproate for bipolar related CAPGRAS. 4. Cholinesterase inhibitors or memantine for dementia related cases. 5. Electroconvulsive therapy ECT for treatment resistant cases. Nursing management 1. Establish a therapeutic relationship based on trust and empathy. 2. Provide a safe environment to prevent aggression. 3. Reassure and reduce patients' anxiety. 4. Educate caregivers about the disorder. 5. Encourage adherence to medication. 6. Monitor for side effects of drugs. 7. Support daily functioning and activities. Treatment options 1. Pharmacotherapy, antipsychiatrics, antidepressants, mood stabilizers. 2. Cognitive behavioral therapy CBT to challenge delusional beliefs. 3. Supportive psychotherapy. 4. Treatment of underlying neurological conditions, stroke, dementia, etc. 5. Family therapy for caregiver support. Psychosocial medicine 1. Psychoeducation for patients and families. 2. Social skill training to improve interaction. 3. Support groups for patients and caregivers. 4. Coping strategies to reduce stress. 5. Community based rehabilitation programs for chronic cases. Prevention No specific prevention but risk reduction strategies include 1. Early treatment of psychiatric and neurological disorders. 3. Avoidance of substance abuse. 4. Proper management of dementia and brain injury. 5. Regular psychiatric follow-ups. In conclusion, CAPGRAS syndrome is a rare but serious psychiatric and neurological condition where individuals believe their loved ones are replaced by imposter. It is most often associated with schizophrenia, dementia, and brain injury. Early diagnosis, combined pharmacological and psychotherapeutic interventions, and strong caregiver support are crucial for effective management. While complete prevention is not possible, timely recognition and treatment can improve outcomes and reduce complications. Thank you. Have a nice day.